For far too long, convoluted and complicated drug pricing strategies have allowed corrupt pharmacy benefits managers and drug manufacturers alike to create huge profits based on the negligence of providers and pharmacies. This, in my opinion, is the best possible healthcare system, and it would prevent all of this waste from ever happening, while being fair to everybody, including the drug manufacturers and pharmacy benefits managers. I thought that these interventions would come several years in the future, but unfortunately, in lieu of recent events, Rite Aid closing, thousands of stores or whatever across the United States, something needs to be put into motion now. For a future America with much better drug pricing, this is what I would recommend, and unless somebody stops me, I will try my hardest to make sure all of these things happen. Number 1, transparent pricing. Generally speaking, the FDA approves medications based on more of safety than efficacy. This is okay. The theory is that the free market would select the winners and the more prescriptions would be made for the better medications, the more cost-effective medications. But in practice, this isn't happening, and it really has never happened, at least not in my lifetime. Studies have shown that physicians tend to overestimate the cost of inexpensive drugs and underestimate the cost of expensive drugs, chiefly because they don't have access to accurate drug pricing information. Oftentimes, I see physicians quickly Google the price of a medication, and then they'll be met with something called an AWP, or average wholesale price. They will then use this number for making decisions, but unfortunately this number is not accurate. It may sound nice, it may sound like something you would want to know, but in fact it's quite irrelevant. The average wholesale price is a billing term, and to give you an example, take a look at this. Lidocaine 5% patches, 30 of them, the AWP is $1,000. If you walk into Walgreens without any insurance, they would charge you $155. With crush cost at Walgreens, it's $82. At any given time, there's about 10 different prices for a medication, making it impossible for an untrained person to actually fully grasp the value of a drug. In my future American healthcare system, only 3 are really that relevant, and they should be displayed to the physician before they make a prescription. The first price is the NADAC price, which is what most people would call the wholesale price. It's what the pharmacy actually pays whenever they buy a medication. The second price is the price the payer reimburses the pharmacy, and as far as I know, this actually doesn't have a name, although it's, in my opinion, very, very relevant. And the third would be the cost to the patient, which is typically a copay or coinsurance, or if they don't have either, it would be the usual and customary price. Giving these numbers to the physician before they make a prescription would eliminate so much waste in our country. For example, it would prevent scam drugs like Duexis from ever existing. Duexis is a combination of 2 over-the-counter drugs you can buy at Dollar Tree, but that didn't stop Medicare between 2018 and 2022 from spending $196 million on it. This one intervention is worth at least $196 million. Ideally, the physician would also see stock at the pharmacy as well. That creates a point of contention with my colleagues. I'm not really sure why. Number 2, pharmacists should be moved out of the pharmacy. This is a current picture of how our prescriptions are sent. As you can see, if there's an issue, it causes a lot of back and forth between the pharmacy and the physician. I'm sure everybody has experienced this, unfortunately. This is slow. It causes delays, and it creates an incentive for the pharmacy and the pharmacist to not intervene. Why would I make more work for myself? They have a $0 copay. Just let them have it. This is how I imagine the future American healthcare system working. The pharmacist overseeing the physician, or probably several physicians really, helping them get into good prescribing habits. This would make more streamlined communication between the cost expert and the physician. The actual brick-and-mortar pharmacy itself can simply be a dispensing machine like everybody thinks it is already anyway, overseen by an advanced trained technician or someone that you can trust to make sure quality is at a nearly perfect standard. This allows the cost expert, or I guess the pharmacist, to help the physician get into good prescribing habits. Specifically, this would allow the pharmacist to practice good dosage form manipulation. This is something that's not practiced enough, if at all, in today's society. Pharmacists are the only profession that are trained in the dosage form of the medication, which is very, very relevant, especially when we're talking about price. For example, sertraline capsules are 10 times more expensive than tablets. Crushing a Xarelto tablet is about a half or maybe even a third the cost of prescribing Xarelto liquid. In this healthcare system, the pharmacist would be helping the physician make better, more cost-effective decisions, causing our overall spend on medications to drop even further. Number 3, PBM reform. In my ideal healthcare system for America, PBMs would still exist, but they would not be necessary. They would only be an added bonus to help negotiate different contracts for pharmacies and third-party payers, like they were supposed to do to begin with. Number 4, a universal electronic medical record. This would benefit our country for so many reasons. I won't even take any more time discussing it because it's very, very obvious. This may or may not include a single-payer healthcare system. I have no comment on this. I don't really care. Number 5, redefining what a prescription actually even is, and also refills. In the olden days, a physician would write on a piece of paper, the patient would take it to the pharmacy, and the pharmacy would give them something that is now antiquated, and a very stupid band-aid we put on this whole process was e-scripts, which I don't think is a very good change in my opinion. So now with a couple clicks, the doctor sends the prescription electronically to the pharmacy instead of the patient taking a physical piece of paper. Borrowing, I believe, an idea from some of the Nordic countries, I believe already implement this. Pharmacies and physicians' offices should be connected through a singular EMR, which allows the physician to create an order, and whatever pharmacy the patient wants to use can then download that order, is the term they use, to the pharmacy. And whenever the physician deems that the therapy is no longer appropriate, they simply cancel the order and the pharmacy can no longer access it. This eliminates the need for refills completely, which removes that burden from the patient from trying to understand pharmacy law. For those of you who don't work in a pharmacy, you probably don't understand that, but for us who do work in a pharmacy, it's very difficult, especially for the elderly, to know what the difference between a refill and a new prescription is, and when they can get them refilled and all these other things. So I want to remove that burden from the patient with this system. This very obviously would increase patient satisfaction, decrease frustration, probably it would increase adherence as well. Number 6, there should be regulations for the supplement industry. That's not really as important as all the other things I just said, but I do want that to happen as well. I have looked at this hypothetical healthcare system from every single angle I could think of, and so far I haven't really found a whole lot of issue with anything I just said right there. I believe this is the best thing for this country moving forward, but I want to hear from you too. Please let me know in the comments if you disagree with something I just said or if you have a way of making it better, and also tell me your qualifications as well in your comment.